Joining us in the studio is Dr. Tobias Winkler, a doctor of orthopedics and also a researcher on muscle regeneration. Now, Dr. Winkler, why go through this complicated process of breeding bones and joints instead of just putting in a new one out of metal?
The new ones out of metal are never that good as they are promised to be. So patients get gradually older and they need exchange operations, and with every operation, tissue has to be sacrificed and function is deteriorating.
And is there actually hope that one day these artificial breeded joints will be as good as the original ones?
The hope exists, although we are far away from that.
It seems quite easy to breed the bones, but it seems very complicated to breed joints. Why is that so?
So first of all, the joint is a complex organ with bone and cartilage being in one organ together. Bone is actually a very simple tissue, because bone remembers how it growed.
Actually, when we break our bones, then they will just heal again by itself.
Absolutely, yeah. This is the fact. So the bone will heal by itself, and the cartilage doesn't know how to heal, so we need to help him.
Why is it so?
Cartilage has no vessels which bring blood and oxygen to the tissue, and bone has its vessels, it has its nerves, and with this all the circumstances which are needed for bone regeneration or for tissue regeneration are fulfilled in bone.
But does it work quite well to breed actually artificial cartilage?
It works quite well, as you put it. We already harvest cartilage out of patients, and we then cultivate this in the lab, and the cartilage is then put back into the patients either in structural forms or without structure. We even can put only structure in cartilage defects, and the patient will reseed or refill these structures with its own cells, and these cells then they mimic cartilage.
And that means you can already help people suffering from arthritis today?
Arthritis is another problem, because arthritis is more or less a systemic disease of the joint, and the cartilage lesion, which is circumscribed, a sports lesion, is better to treat.
I understand. What about the muscles? Is there a chance to breed muscles?
There is a chance, although for the in vitro cultivation, only very small muscles have been bred yet. Although we are gradually knowing now that the muscle is a very, very important organ for the joint, because it moves the joint, and this is all the effort we just put in.
And that means you just inject stem cells into a hurt muscle to make it heal again?
Yes, exactly. So in the animals, we already had very good results with stem cell injections, stem cell transplantations into injured muscles, and we got a very good improved muscle function for that.
Thanks a lot for the talk, Dr. Tobias Winkler.
No problem.